I'm going to be talking about promoting smarter decarceration in the United States. Decarceration is the process of releasing or removing a person from an institution. An institution can be defined as a rehabilitation service, a prison, a juvenile detention center, or a mental health asylum, anything that a person is resorted to after they have had a traumatic experience. It's our job to do this because there are so many controversial discussions happening right now among people who are committed that reoffend once they are being released, due to the simple fact that they are not given the resources and they are not being taught how to care for themselves once they are open back up into the general population. It's very important for our class to learn about this because we advocate for mental health and those who are at a disadvantage, and this is a very important discussion to have, just not for our health but also for the health of those who are being released back into the public. There are actually a lot of different debates happening in the world of decarceration and how well these people are prepared to be released back into the environment. One of the bigger debates happening right now is among releasing people because of COVID and the regulations that are in each state and overall in the country. There are a lot of decarcerations happening for the simple fact that there's not enough room to safely hold and house those because of COVID and the regulations that are in process right now. I personally know someone who was released after being sentenced to 6 years after 6 months because he was considered a non-violent inmate from the local prison of my hometown, and I just don't see it as being very appropriate and mature of us to simply allow that to happen without knowing that he has the resources and adaptable abilities to conform back into the society and get a job without failing. We are technically setting these people up for failure, and it's very sad because then we want to point the finger at them once again once they recommit or reoffend, anything like that. There are a lot of different branches once it comes to smarter decarceration, and students are able to look into things such as mistreatment, regular treatment, a locational thing, whether it depends on the state or local or federal levels, how these inmates and patients are being treated. Another thing that they could look into would be the race, ethnicity, cultural identification among patients and inmates, and whether that has an impact on how successful they are being released back into the public. Another would be recommitment statistics and how often someone and what crime they are willing to recommit. Another would be what are some programs that we can implement to help these people on the outside, not on the inside, but on the outside of their institutional stay, and whether those are actually helpful. The last that would be really interesting to look into is whether we should have a psychological screening and how that would go in order to tell if they are more likely to recommit and whether they are a violent person or not. The macro level of decarceration is going to involve the entire general population of the U.S. because there have been many times where a person in question of being recommitted or a person who is in question of reoffending has eluded authorities to the point that it affects an entire nation and they harm people throughout the entire country. The micro level is going to be local and immediate programs that they can reach out to at that very moment so that it helps them readjust and make sure that they are on the right path. For my personal statement, I just want to say that I've personally seen way too many docuseries and documentaries concerning people who were once institutionalized and they are being released prematurely, whether that premature be time or good behavior. They are released back into the public without anyone acknowledging that they are not safe to be returned back to the public. I think that it's really important for us to start paying a lot more attention to what we're releasing back into the public and to remember that these people are also humans just as everybody else is. They just need a little bit more help in terms of psychological and mental, emotional, physical help. So we should be the ones who are there in order to support them.